So, good afternoon. Good afternoon. I am Jane Kirschling, and I have the true pleasure of serving as the Dean of the University of Maryland School of Nursing. And I'm here to welcome you to the ribbon cutting ceremony for the clinical simulation labs at the School of Nursing at the universities at Shady Grove. Today we will celebrate our beautiful simulation facilities. Two are brand new, 6 have been handsomely modernized and refurbished, and all have benefited from the installation of new and cutting-edge equipment and learning technologies. None of this would have been possible without the significant financial support and partnerships of the University System of Maryland and the universities at Shady Grove, which enabled the construction and renovations. We are also very grateful for the generous contribution from the Bedford Falls Foundation, which provided new equipment for these labs. Today is more than a celebration of these new clinical simulation labs. These expanded and upgraded facilities are an outgrowth of the School of Nursing's overall enrollment and programmatic expansion, including our programs here at the universities at Shady Grove. Contextually, this growth has occurred in part in response to the national and statewide need to increase the number of baccalaureate-prepared nurses in Maryland, as well as the number of doctorally prepared nurses. In its landmark 2010 report on the future of nursing, leading change, advancing health, the Institute of Medicine noted that in order for our nation to address the increasingly complexity of healthcare and the growing diversity of our communities, it would need greater numbers of highly educated nurse clinicians, nurse educators, and nurse scientists. The School of Nursing is committed to meeting Maryland's need for these nurses, and we are making enormous progress. Since we began offering our Bachelor's of Science in Nursing program here in Rockville with the 2000 opening of the universities at Shady Grove, we have continually grown enrollment. We have added new programs, including the RN to BSN degree that enables practicing registered nurses to return to school and earn a baccalaureate degree. And just this month, we have expanded our Doctorate of Nursing Practice program's Family Nurse Practitioner specialty to the universities at Shady Grove. We are grateful for the support that we have received for this expansion from the Nurse Support Program 2 grant, NSP2 grants, which are funded by the Maryland Health Services Cost Review Commission and administered by the Maryland Higher Education Commission, have been instrumental in fostering the expansion and education of Maryland's nursing workforce. Collectively, the School of Nursing's degree programs here at Shady Grove are helping to make it more convenient and attractive for students and practicing nurses from the western regions of Maryland to obtain nursing education and degrees. I am proud to report that as of this month, we now have 310 students studying at the School of Nursing at the universities at Shady Grove. We also have 21 faculty and staff members here at the universities at Shady Grove. Our 310 students include 255 baccalaureate students who are doing their entry into practice degree here, 41 RN to BSN students, and our initial class of 12 family nurse practitioner students. We also have 2 individuals taking courses at the School of Nursing as special students while finishing their associate degrees in nursing at our dual admission community college partners. These students will then seamlessly transfer into our upper division level program and earn their baccalaureate degree. This fall, 39% of the 660 baccalaureate entry-level students enrolled in the School of Nursing are obtaining their degrees at Shady Grove. This overall expansion is phenomenally important as we strive to make nursing education accessible and affordable for students throughout Maryland. So as we celebrate these magnificent clinical simulation facilities, we do so in the much larger context of important programmatic growth that addresses the need for well-educated professional nurses throughout Maryland. And the simulation labs that we celebrate today are a vital part of meeting the need for more and better clinical preparation for our future nursing workforce. Fully integrated into the curriculum, clinical simulation allows students to gain experience through participating in highly realistic case scenarios under faculty supervision. These experiences prepare students for clinical practice in hospital and outpatient settings, as well as for home visits. It allows students to gain highly realistic and applicable experience that builds competency and confidence without the potential of compromising patient safety. It also allows students to practice rare and critical events that they may never see during their nursing education, but may very well experience during their careers as nurse clinicians. Simulation also plays an important role in allowing seasoned practitioners to develop new skills and expand their abilities, and for students from multiple disciplines to come together to learn about team-based care. Today, you will have the opportunity to tour our 2 brand new simulation lab spaces on the 1st and 2nd floor. On the 2nd floor, you'll also be able to visit the renovated and upgraded Objective Structured Clinical Examination Suite, known as OSCE for short. Each of the rooms is outfitted with cameras and audio that allows for observation, evaluation, and feedback, and importantly, they will also be utilized for interprofessional education. On the 3rd floor, you'll find 6 fully refurbished spaces, including an obstetrics pediatrics lab with a mannequin capable of giving birth in a highly realistic manner, sort of, as well as spaces for learning health assessments and exams. A total of 8 clinical simulation labs plus the multi-room OSCE suite. So there will definitely be a lot to see, and I encourage you to take a guided tour with one of our faculty or staff members. With this as a bit of context and background, I'm now delighted to introduce the president of the University of Maryland, Baltimore, Dr. Jay Perman, who's taken the time to be with us today to join our celebration.
Thank you, Dean Kirschling, Dr. Edelstein, government officials, community partners in the business community and otherwise, faculty, staff, students, everybody. I'm thrilled to be here at Shady Grove because this is a very important event. It's an event that prepares people to be tomorrow's caregivers. And I want to thank the Dean. I want to thank Dr. Edelstein for their vision, their leadership. And I thank all of the Shady Grove faculty and staff who are the people on the ground every day. It's the cutting-edge training you provide that turns our capable students into the kind of professionals each of us wants to be taken care of, exceptional professionals. I too thank the Bedford Falls Foundation and the University System of Maryland for their generosity and partnership. University System of Maryland Regent Louis Pope is here with us today. Thank you very much for supporting this vital project. Louis, please raise your hand. Now, I suspect that the vast majority of you don't know that at the behest of the Chancellor and the Regents, I am chairing a system-wide group of university presidents specifically to look at Maryland's healthcare workforce. How do we promote high-quality training and ensure that we have enough health professionals to meet the overwhelming needs of this state? The group came up with a long list of items at its initial meeting, things that we need to address in looking at the healthcare workforce, dozens and dozens of them. And yet, among the very first issues that this group chose to tackle was the availability of simulation facilities. That issue made the cut because everyone agrees that making sure students get adequate experience in simulated environments is absolutely central to preparing a skilled workforce. And so I couldn't be happier to see us addressing this issue the way we are today. It validates our work, it validates the importance that we're giving to simulation. And there's another issue that the work group is tackling, making sure that all across Maryland, in every region, we have a well-qualified healthcare workforce, that there's nowhere in Maryland where Marylanders will struggle to find a provider, where one will struggle to find ready, capable care. And that's why it's so important, Dean, that UMB School of Nursing be represented here in a highly strategic place like Montgomery County, with its dense population and its considerable healthcare needs. We need to make sure that all Maryland students have an opportunity for this kind of first-rate education so that they can serve where they're so badly needed. And finally, I just want to say that I'm thrilled to see the upgrades to the OSCE suites that you mentioned. I know that this suite is very important for interprofessional education, team-based care, that it lets nursing students interact with pharmacy students and soon with social work students, and that it's important for training in home visits. You all know that it does my heart very good to see everyone working together for the best patient and client outcomes. So congratulations on these wonderful facilities. I can't wait to see them being put to good use.
So I'm very, very excited about today for several reasons. One, we are celebrating the opening of an extensive renovation of the facilities to support our allied health programs, and especially the initiatives of the School of Nursing to expand its enrollments in its baccalaureate programs, and in bringing its new degree, the Family Nurse Practitioner Doctor of Nursing Practice degree program. I remember talking to Dean Kirschling several years ago about the School of Nursing at USG and saying, you know, it's a great program. We'd love to be able to have more of you. And I mentioned specifically the Doctor of Nursing Practice, and I remember her very cautious over lunch saying, well, let me look into that. Let me see if that's possible. I understand what you're saying, and here it is several years later, and the program is here, and it's due in large measure to her leadership. But we are also celebrating and acknowledging, as you heard earlier, a very successful partnership between the School of Nursing, University of Maryland, Baltimore, USG, and Montgomery County. Nursing has had a presence in Montgomery County for many years, even before USG was established. But at USG, nursing has flourished and expanded and developed stronger relationships with health organizations in the greater region, advancing its partnership with Montgomery College on a very innovative 3+1 program to support a robust pathway to a bachelor's degree in nursing, and participating in many initiatives through USG, like our Frontiers in Science and Medicine program, which focuses on middle school students and getting them interested in health careers. One initiative that I am particularly pleased about, and you've heard a little bit of it mentioned by both Dr. Perman and Dean Kirschling, is the UMB Center for Interprofessional Education in Health Sciences. Now that, under the leadership of Dr. Perman, and Dean Kirschling, who chairs that group at UMB, USG is participating actively in designing curricula and field experiences in various clinics in the county for students in allied health professions to learn to work together as teams in improving the delivery of patient care and providing quality health care for all of the citizens in Montgomery County and the greater region. This important initiative will be advanced in the new Biomedical Sciences and Engineering Education Facility with a community dental clinic from the UM School of Dentistry and a community clinic, an interprofessional community clinic at USG supported by University of Maryland, Baltimore as a teaching site for students across many health science disciplines and across multiple institutions. Very innovative. For these reasons, I am excited about today and want to thank UMB for its leadership and particularly the work of the School of Nursing, which will be enhanced by these new facilities. Thank you all for coming, and I hope you enjoy the tour and the hard work that's being done here to support the education of professionals in health sciences. Thank you so much.